All right, now we're going to talk about the RN to BSN program. The RN to BSN program usually takes 18 months to 2 years to complete, and it is for those ADN prepared nurses who now want to move on to get their bachelor's. So this program usually just fills in what wasn't taught in those ADN programs. So theory, specialized nursing courses. So you're going to see gero and mental health and evidence-based practice and leadership and those types of courses that they don't have time for in the associate degree level nursing programs. So at the completion of the BSN program, the students are going to be able to provide that same practice, safe, evidence-based, patient-centered care. They're going to, basically maintain their same job, but they have a lot of opportunities now for advancement. So they can be leaders or educators or move up in the pay grade. So a lot of room for opportunity for advancement there. General concerns with shadow health. I would say the most things that we hear are these students have been practicing for a number of years. I'm concerned that shadow health is going to be a little bit too basic for them. And also time is a big factor with the RN to BSN programs because oftentimes students are a little bit older. They have families, they have full-time jobs, and they are, juggling work and school and their family life. So the time that these assessments take is definitely a factor. So discussion points for those, I would say that number one, turning off the interview guide is a good option if professors are concerned that students have been practicing for a long time and this will be too basic for them. So that will really allow them to stretch their skills and see how well they can do. Although it may seem basic to some students, it can be challenging to others. So there are a lot of different levels coming into these RN to BSN programs. Maybe some nurses have been practicing for 10 years, but maybe other nurses have been only practicing for 6 months. So there's a lot of different levels, and what shadow health can do is it can be that bar, that measuring stick to ensure that all students graduate the program on the same level or hit that minimum level of competency before moving out of these health assessment courses. Another nice discussion point is RN to BSN programs are mainly online now because they need to accommodate the shift work associated with nursing, and shadow health can be done anywhere at any time to really accommodate these students and allow them that quality, evidence-based, research-validated practice at any time of the day. Now for the courses, we have these commonly required courses. Of course, the health assessment is what we talked about. That undergrad health assessment fits very nicely in there. There are some RN to BSN programs that use the graduate version, but I do not recommend that. That would be way too high of a level. I would absolutely recommend undergraduate health assessment, again, to use as that sort of measuring stick to make sure everyone is, graduating the program with the same level of assessment skills at a certain minimum. Next, we have the community course, which we talked about before. This could be a fit as an outpatient visit. Students could practice looking for outpatient resources for Nicole, since she, again, is an outpatient visit, and take a look in their own communities and kind of see what's there for them and have them practice looking for resources for patients within their own communities. And then finally, there is a gerontology course in the vast majority of RN to BSN programs, and our gerontology product fits very nicely in there.